First at 6, healthcare workers continue protesting against planned service cuts across the UVM Health Network. Earlier today, people rallied in front of the UVM Emergency Center in Burlington, marking the third week in a row a group has condemned the network's actions. ABC 22's Jordan Barber shares more of what they all had to say. She now joins me live in the studio.
Thanks, Matt. Nurses, support staff, and technical professionals at UVM Medical Center marched along Colchester Avenue this afternoon to protest the closure of multiple clinics. Some were even carrying beds to represent the impact of the closure on patients. Healthcare workers say they are concerned for the well-being of their patients after UVM Health Network CEO Dr. Sunny Eapen proposed selling the network's dialysis clinics on November 14th. The CEO's proposal also suggests the closure of the Mad River Health Center, transplant clinic at UVM Medical Center, and inpatient psychiatry at Central Vermont Medical Center. The announcement of the cuts comes after the UVM Medical Center brought in roughly $80 million more in patient revenue than it was supposed to last fiscal year. Dr. Eapen says the decision was the last one that the healthcare network wanted to make, but that it was necessary to comply with the Green Mountain Care Board's orders.
That was the only option that we had. That is that we had to decrease services in order to comply with the law and the budget order. And so no matter what we chose, whoever was impacted by that was going to feel the pain.
In response to the cuts, Green Mountain Care Board released a letter on November 26th calling the closure of a psychiatry unit at Central Vermont Medical Center, quote, deeply troubling. The letter is now asking for the network to provide the board with more information and answer questions before moving forward. Heather Bauman, a phlebotomist at the UVM Medical Center, says she believes that the hospital is making cuts in the wrong places.
There are neighbors, friends, patients, family members who will not be able to access care, and that's unconscionable, and that's not what the hospital is asked to do.
Brendan Lawson, a medical assistant at UVM Medical Center, says he worries that the cuts will force his patients to go miles away. He says he hopes the hospital will reconsider the cuts and find other ways to reduce costs.
People can't just go somewhere else. And so I'm here because this is literally life or death for the patients that we are cutting services from.
The UVM Medical Center has until December 13th to respond to the Green Mountain Care Board's letter. Dr. Eapen says he hopes to continue to meet regularly with the Green Mountain Care Board and other partners to work on long-term solutions. Meanwhile, today's protesters say they will continue to hold rallies and will hold out hope that the proposed cuts will be reversed. Reporting live in the studio, Jordan Barber, ABC 22 News.